Understanding Creutzfeldt-Jakob disease, let's just jump in. Creutzfeldt-Jakob disease, or CJD, is a rare and devastating brain disorder. It belongs to a group of diseases known as prion diseases. These diseases affect the brain and nervous system in a destructive way. CJD is characterized by its rapid progression, leading to severe neurological decline. Sadly, there is no cure for CJD, and it is ultimately fatal. CJD occurs when a protein called a prion misfolds and accumulates in the brain. This abnormal protein accumulation disrupts normal brain function, causing a range of debilitating symptoms. A clinical neurologist will rule out other conditions with similar symptoms. They'll also check for some common signs of CJD by carrying out the following tests. An MRI brain scan uses strong magnetic fields and radio waves to produce a detailed image of the brain and can show up abnormalities, particular to CJD and EEG. Records brain activity and may pick up abnormal electrical patterns seen in sporadic CJD, a lumbar puncture. A procedure where a needle is inserted into the lower part of the spine to draw out a sample of cerebrospinal fluid, which surrounds your brain and spinal cord, so it can be tested for a certain protein that indicates you may have CJD. A prototype blood test for variant CJD has also been developed by the Prion Unit at the Medical Research Council, MRC, and is available through the National Prion Clinic, a tonsil biopsy. A small piece of tissue can be taken from the tonsils and checked for the abnormal prions found in variant CJD. A genetic test, a simple blood test to find out whether you have a mutation, fault in the gene that produces normal protein. A positive result may indicate familial inherited prion disease and require a brain biopsy. During a brain biopsy, a surgeon drills a tiny hole into the skull and removes a small piece of brain tissue using a very thin needle. It's carried out under general anesthetic, which means the person will be unconscious during the procedure. As a brain biopsy carries the risk of causing brain damage or seizures, it's only performed in a few cases where there's a concern that someone doesn't have CJD, but some other treatable condition. Ultimately, the final diagnosis comes after death with a brain biopsy. As the disease advances, patients experience a rapid decline in cognitive and motor functions. Symptoms can include memory loss, personality changes, and hallucinations, making it a devastating diagnosis for both patients and their families. The progression is often swift, with many patients succumbing to the disease within a year of onset. Due to its rarity and complex nature, CJD can be challenging to diagnose and manage. Early symptoms are often nonspecific and can be mistaken for other neurological disorders. This makes timely diagnosis difficult, and by the time CJD is identified, the disease is usually in its advanced stages. Advanced directives are so important with this diagnosis, wanting to know what the patient's wishes are while they are able to share these wishes, things to consider. Where does your loved one want to be as their disease progresses? What kind of spiritual care do they want? Comfort measures having this paperwork done while they are able to communicate their feelings and wishes. There is also paperwork called Last 5 Wishes. Do they want music in the room? Who would they like in the room visiting? Do they like physical touch? The impact on families is profound. Watching a loved one deteriorate so quickly is heart-wrenching. The emotional and psychological toll can be immense, as families struggle to cope with the rapid changes and the inevitable outcome. Support for families and caregivers is crucial as they navigate the complexities of the disease and the healthcare system. Palliative care and counseling services can provide much needed support during this difficult time. Understanding the disease, its symptoms, and available treatment options is crucial for patients, families, and healthcare providers alike. This knowledge empowers everyone involved to make informed decisions, manage expectations, and improve the overall quality of care. For patients, understanding their condition can alleviate some of the fear and anxiety that often accompanies a diagnosis. It allows them to actively participate in their treatment plan, ask pertinent questions, and adhere to prescribed therapies more effectively. Families, too, benefit from this understanding as it helps them provide better support and care for their loved ones. They can recognize symptoms, manage medications, and offer emotional support, which is invaluable during challenging times. Caregivers, who are often family members themselves, face immense challenges. They must provide constant care, manage complex medical needs, and make difficult decisions, all while dealing with their own emotional turmoil. This can lead to caregiver burnout, a state of physical, emotional, and mental exhaustion. It's crucial for caregivers to have access to support systems such as counseling services, respite care, and support groups where they can share their experiences and find solace. Support groups play a vital role in helping families navigate the challenges posed by CJD. These groups offer a safe space for sharing feelings, gaining insights from others who are going through similar experiences, and receiving practical advice. They can also provide valuable information about the disease, treatment options, and resources available for patients and families.